Greetings, colleagues. My name is Dr. Michael Schaer. I am on faculty at the College of Veterinary Medicine at the University of Florida, where I have been for the past several years, practicing the specialties of internal medicine and emergency and critical care. I'm going to discuss three of the most common questions asked about venomous snake bites and dogs and cats. Our first question is, what areas in the United States are the most prevalent for venomous snake bites, and which snakes are most frequently involved? And we'll start from the West Coast and work our way to the East Coast. In the West Coast, the most common rattlesnakes are the northern and Pacific rattlesnakes. And as we move a little bit to the eastern part of California and into Nevada and Arizona, we will find the western diamondback rattlesnake. And in Nevada and Arizona, you'll also find the Mojave rattlesnake. Texas and Colorado have a few rattlesnakes, especially Texas. Colorado mainly has the prairie rattler snake, and Texas will have an assortment depending on which part of the state you're in, but they can have some western diamondbacks and they can have the prairie rattler as well. As we move more toward the East Coast and we get into the area of Florida, we will have a concentration of 5 or 6 venomous snakes, and these include the eastern diamondback rattler, the water moccasin, the pygmy rattlesnake, the timber rattlesnake. We will also have in Florida a high concentration of the coral snake. The coral snake belongs to a different family of snakes, and their venom is especially neurotoxic. The coral snake is also represented in Texas and Arizona, but in Arizona, it is not so much of a threat to the victim. We will have the copperhead distributed to the northwest part of Florida, and then expanding northeast up through Georgia and through the Carolinas and other states. The next question is, what are the consequences of envenomation? And the answer to that will depend on which snake is involved. If we talk about the so-called pit vipers or the crotalids, which includes the rattlesnakes and the water moccasins, these snakes have a diversified venom that could have several adverse effects on the victim, which include disturbances in coagulation, destruction of red blood cells, and adverse effects on the central nervous system. In addition, the venoms of the pit vipers are notorious for being tissue toxic and causing a fair amount of soft tissue damage. We will find that snakes such as the copperhead has mainly a tissue toxic effect with not so many other life-threatening effects as we'll find in Florida. The last question is to discuss the best treatment recommendations and the prognoses. I'm happy to say that in most situations, snakebite envenomations is associated with a fairly good rate of survivability in this part of the world. We'll find that with certain snakes, such as the prairie rattler and the copperhead, treatment might entail intravenous crystalloid solutions and limited amounts of antivenom, because most of the venom effects in those particular snakes is tissue toxic and not so much life-threatening, but there are exceptions to that. As far as the numbers of of antivenom vials to administer in a condition caused by the prairie rattler or the copperhead. It might be 1 or 2 vials. Rarely do you have to go over that. In some cases, you don't have to give any antivenom. Again, this depends on the severity of the problem at hand. Now, when we're talking about moderate to severe envenomation, where the animal is showing severe signs characterized by low blood pressure, coagulopathy, hemolysis, and perhaps neurotoxicity, larger amounts of antivenom given during the early phases of envenomation are essential for a favorable prognosis. And we're talking there around maybe starting off with 5 or 6 vials in situations of large eastern diamondback or water moccasin envenomations, and to repeat that treatment with X number of antivenom vials on an every 6 to 8 hour period for the first 24 hours. And this will all be dictated by the animal's response to the treatment. In a recent paper that we published out of Florida in the journal Toxicon, we found that our mortality rate was only around 5%, but much of that being due to the fact that we've learned over the years to give larger doses of antivenom for the most severe situations. This will conclude my presentation, and I want to thank you all for joining us today for this interview regarding venomous snake bites in the dogs and cats. Thank you.